Welcome to Community and Conversation. I'm your host, Tanya Acker. And here with me on the very first episode of this podcast is the president of the Beverly Hills West chapter of the Links Incorporated, Zna Portlock Houston. Welcome, Zna.
Thank you, Tanya. I'm glad to be here. I'm excited about this launch and what we'll be able to share.
The pleasure really is all mine. So just to bring people up to speed, Zna is also the president of my chapter. I'm a member of the Beverly Hills West chapter of the Links. And Zna and I were on the phone having a conversation about some Links business. And she poses this great idea, which is to do precisely this, to have a conversation with the community about the work of our chapter. And of the Links. And when she proposed this, I jumped out of my chair, basically, and because I thought it was such a phenomenal idea. But Zna, why don't you just share a little bit about why you wanted to do this and why you had the wonderful idea to have these conversations with the community right now? What was on your mind?
Well, I'm always interested in seeing how we can expand our reach as the Beverly Hills West chapter. And, there's so many sidebars, if you will, going on within our community and looking at ways we could unify some of those conversations. So community in conversation was the concept that popped into my mind as I was speaking to you, and knowing your background as a journalist, as a lawyer, it just seemed to be a perfect fit for our chapter to be able to have its own podcast and share messages and information that really impacts us all.
It's always an incredible opportunity when people have a chance in community to both connect with one another and to really engage in what's important to them. The mission statement of the Links is friends transforming communities through service. Can you talk a little bit about how the work of the Beverly Hills West chapter furthers that mission?
Well, that's one of our tenets. We have two tenets, right? Friendship and we have service. And so as friends, we come together and we literally seek to do work that transforms our community in various ways, whether it's through the arts or it's through national issues that touch upon our community and being an advocate in those particular areas, whether it's health and human services, and how can we transform communities in that way. So we have 5 different focus areas, and through those focus areas, as friends, we work really hard through service initiatives to pull our community together, to educate our community, to make a difference for our community. And that is all part of the mission of the Links Incorporated. Our chapter is just one of many chapters. There's over 200 chapters across the globe, literally internationally. And so our chapter does its part to fulfill that mission.
I think that a lot of the times when people hear about organizations doing work in the community, right? Like that, it's almost become a commonplace saying, everybody says, and we're doing the work in the community. When one can point to specific things that are happening in the community and where, the work is really making a difference, I think it really goes a long way, to pointing out that what you're doing is more than a soundbite. I have been particularly impressed by our work writ large, but I think some of the things that the Beverly Hills West chapter is doing in the public health space to try to improve health outcomes for Black people has been particularly potent. Can you talk a little bit about some of that work? You've spearheaded a lot of it.
Well, as the president of the chapter, I get the credit oftentimes for spearheading, but it's really the work of our members coming together and taking the time and planning to make these initiatives work. And so recently we had a forum on kidney care. and sharing information about making sure members of the community understand their numbers and what does it mean and how does it impact you if you have a high glucose level, if your blood pressure is too high, is it normal, is it elevated, etc. And so I'm not a physician, but I certainly learn a lot from the physicians in our chapter. We call them the real doctors of Beverly Hills West, and they definitely spearhead those initiatives and make sure that through our health and human services focus that we can reach the community with information that they may not get other ways. I mean, it's important, just as an example, for all of us to understand that we have to be an advocate when we're sitting in that physician's room. And a lot of times we want to, of course, listen to what the doctor says, but sometimes we're afraid to ask questions. And to hear a medical professional tell an audience of people that no, it's okay to ask questions. You absolutely should be asking questions and querying about different things that you're advised to do and not to do. What's the why behind it? What's the rationale? And if you're not able to do that, then bring someone along with you that can be an advocate for you in that regard. So kidney care, that's been something our chapter has been engaged in for the last 3 years. We also did a Black Family Wellness Expo where we had different elements related to overall family wellness. Yoga was a part of that event. Dental care was a part of that event as well. So it's just different aspects of healthcare that we're able to expose the community to. We even had a blood drive recently, and a lot of times I'll say the royal we don't like to give blood for a variety of personal medical reasons as well as historical reasons, and in terms of how will the blood be used, etc. But we proudly collected over 40 pints of blood by partnering and collaborating with the community and reaching those who were willing and able to give blood, and that saved a lot of lives. A lot of potential lives are saved through initiatives such as that. So, it spans a spectrum of opportunities to be health focused and engaged.
It's work that's really tangible. You mentioned our kidney awareness event. I had the great privilege of participating in that. And we had community members show up. We had doctors there who gave them firsthand, actual medical information, real facts. And people were tested. People were screened for a variety of conditions that could compromise health. So it was, in fact, really, really powerful. How important do you think it is right now to be doing that sort of tangible work in the community?
I think more important now than ever. I mean, historically, our community has been subjected to lots of pressures and external forces that oftentimes we have no control over. And we continue to have to be resilient in our outlook and remaining positive and knowing that, some way will make a way. And so a lot of that starts with your health, because when you have those pressures and stress can kill you, truly. And so making sure that we're well, that we're whole, our mind, as well as our body, our mental wellness is extremely important, as well as our physical wellness. And when you feel good, I know that, you're able to meet challenges in a way that is more sustainable, and you're not as easily susceptible to the pressures of the world that we find ourselves living in today.
You also mentioned kind of the importance of sort of giving people the tools and the resources to advocate for themselves and to ask the right questions. Again, turning back to our kidney awareness event, for folks in the community to have access to some of the top health professionals in their fields who were giving them information just like real talk, and kind of and giving them access to the information they need to really ask the sorts of questions that they might not know to ask. What role do you think that these sorts of events and that this sort of community engagement plays in ensuring that the community has the resources to advocate for itself?
Well, it's empowering. And I think that's one of the main roles that the work we do plays. It allows the community to be empowered, and we don't just start with adults. We launched a Dr. Me program with middle school children. And so for them to see physicians in their white coats, and they too had their own white coat ceremony, and having, regular workshops where they're learning different things about medicine, public health, where they can see someone who looks like them and to be able to say, oh, I can be a veterinarian. Oh, I can be an internal medicine doctor. There's, I can be a scientist. I can be a research professor. These are all things that help to empower the community, and starting at a very young age, right, where they're starting to make decisions about who they want to be and what they believe is possible for them. And so that's important as well. As I mentioned earlier, we have several focuses, and one of them is also international trends and services. And we had an amazing seminar for the community on women in sports. And the community was able to hear from these athletes, world-class athletes, and how they made it and how they survived and what their challenges were. And so we're really about spreading information, making it accessible, making it available in a way that you might not often otherwise have an opportunity to access. Most of our events are at no cost. The kidney care event was no cost to the community. The Black Family Wellness Expo was no cost to the community. The Dr. Me program, the children participate at no cost. International Women's Day, no cost. But of course, we know there is a cost, right? So our chapter does engage in lots of fundraising too, to help us to be able to sustain these programs. And so we party with a purpose. It's not just a party. When we come together, we're raising money so that we can support our community-based programming and our scholars. We give scholarships to students, and we follow them for all 4 years of their education. Once they're selected, they become a cohort until they graduate. And so we have awarded, well over $100,000 to students during the course of our existence, which will be 40 years. This May 25th, 1985 is when we were established, and we're having a big celebration on May 31st. And so we're all looking forward to that and raising as much money as possible so we can continue some of these programs you and I have been talking about today.
So you mentioned our scholarship programs. Just so we're clear, for folks who are listening and who may not be a Link, they too can donate to our scholarship fund. Correct? I'm correct about that. Yes, Zna?
Absolutely. Members of the community who are not Links are welcome to contribute to the work of our chapter. Our website is beverlyhillswestlinks.org. And we have a donate button. And so we welcome those contributions. And there's information about our upcoming 40th celebration on the website as well. And there's also a link to our scholars. So they can click on our scholars and see who some of the students are that we have been supporting educationally and helping them fund their higher education.
And just so we don't give short shrift to the breadth of the work of the chapter, and the links. Can you talk a little bit about some of our other facets, some of the things that we're doing in the arts? You mentioned international trends and services, national trends and services, legislative affairs. Can you just talk a little bit about some of the other areas in which our chapter is making an impact?
Yes, certainly. So through National Trends and Services, we've done a lot of work with the unhoused community, donating linen and food and hygiene kits, both through churches and through organizations. So that is important work that we also engage in. The arts, exposing young people to arts opportunities through field trips and opportunities of that nature, going to see plays, etc. Again, at no cost to the child or to the parents. And so it's another way that we're in community and that we're a community in conversation. So we sometimes think about, like the theme of this podcast, community in conversation, as we're just talking, right? But I also see community in conversation as when we're out there doing the work and we're standing side by side with our youth. We're standing side by side with our community. We may not be having this kind of a conversation, but it is a conversation. It might even be considered a silent conversation because I'm just who I am, standing next to a youth who sees someone who's presenting professionally. They may have heard my introduction and know that I'm a lawyer, or I'll say a recovering lawyer. And that's a conversation as well. So I feel like this has a lot of different tentacles to it, if you will, in terms of how we outreach. Our services to youth is actually the organization or the entity within our chapter that's spearheading the Dr. Me. And I'll say the Dr. Me conversation, which we talked about a little earlier. So it has a health emphasis, but its focus is on our youth and preparing them for success. You mentioned our Legislative Affairs Resolution Committee. We were highly engaged in getting the vote out. We had a drive at the California African American Museum to get voters registered and just to check and see were they already registered, where was their polling place, etc. And so those are things that we also do. It's a lot of different areas that we engage in, and we have 66 active members, and they all work extremely hard. This is a volunteer organization. So none of us get paid for what it is that we do or that we contribute when we become members of Beverly Hills West chapter. We're signing on to give of our time, of our talent, and our tithes too, if you will. So we give a lot out of our own pockets. We raise money out of our pockets, and we volunteer our time tremendously. And sometimes, it may feel like it's a full-time job. And in some respects, it is. You're taking care of your own family, taking care of yourself, going to work. But then the women who are attracted to this organization and want to be part of it also feel that need to give back. And, to whom much is given, much is required. And so that's what we do. We volunteer our time to make all of these various efforts work well and for there to be a tangible benefit to the community.
How important, well, speaking of tangible benefits, and sort of referencing the Dr. Me graduation, for instance, where our young people are graduating in white coats, feeling as if they are a part of the profession. How important do you think it is for young people to see themselves reflected in sort of different professional realms, to see themselves as to see like folks who look like them accomplishing great things. Sometimes there can be a tendency to give short shrift to that, and some say to make too much of it. How important do you think it is that young people see themselves reflected in all of these other, in various arenas of power and success?
I think it's extremely important. And that's a great question because often the thought or the notion is that if you're serving underserved youth, that they don't necessarily have role models in their home. And they absolutely could have role models in their home, but that's all they're seeing is what their parents or immediate family members do. And they may not know that, oh, there's something else over here that I possibly can do. Or they may be raised in a home where there's a variety of professions that are represented, and maybe they're being channeled to, oh, you can only be a doctor, you can only be a lawyer, you can only be an educator. And they go to one of our events and they see someone excelling in the arts, actually making a living from their artwork, and they have that talent, and perhaps it's been pushed down or stifled a bit because they're being told they can only be A, B, or C, and they see a different world of possibilities. And so I think that exposure that we can offer is tremendously important. And young people have the opportunity through social media and influencers. And I mean, so much information is coming at them from a variety of ways. But when they can actually reach out and touch someone and talk to them one-on-one, they can look at you and say, I can be a journalist and maybe I want to be a lawyer too, but this is a different direction that I can take my skill set to. So it's important that we are always providing our young people with the opportunity to see different walks of life, different professions, and to allow them to see it in execution.
What's next for this chapter? You are beginning your second term as president of the chapter. What's next?
I feel, as I frequently say, I'm privileged to preside. My theme for my term has been honoring our history and advancing our future. And the first 2 years of my term, I spent a lot of time looking at our history and honoring that in various ways and making sure that, we recall and recognize the shoulders that we stand upon as a part of our chapter. In moving forward, the advancing our future, I really want to make sure that we're digging into fund development because it's harder and harder to raise money. It's more difficult to receive grants. The number of grants that are available are shrinking. And so for us to continue this work, it's going to take some innovative approaches. So that's one of the things that I want to do on the money side, because without money, these programs really can't exist. As much as we give our time of our skill set, you still need spaces to, hold these opportunities, etc. And so that's definitely something that I want to do. I'm thrilled that we have this podcast, that it's launching at the beginning of my second term, because I think it's going to be invaluable in so many ways. So many great speakers that you'll be able to bring on and folks that you'll be able to interview to really delve deeper into the work that we do. Today, we're just, having sort of an overview of all of the things we do, but I know that we'll be able to go and dig deeper into the work of our chapter.
As you talk about this work, and as we've had this conversation, which is focused quite a bit on, providing resources to the community and information and all of that, I think that one thing that we've touched on a little less is what we get from the community. We are a part of that community, irrespective of what we do and where we live and, what our various resources are. One of the things that I love about being a part of this chapter and of the Links Incorporated is that, we don't really see ourselves or position ourselves as being separate from the community. We are there in kinship with the community. What does community in that sense mean to you, Zna?
I have a T-shirt that I think is a great T-shirt that was designed by a Black designer, and it says "Kinfolk." Period. There's a period at the end of kinfolk, and I wear that a lot. And anytime I wear it and I'm out, I get all kind of looks and stares, and people have even asked me, "Where did you get that shirt?" And so I agree with you 1,000% that we are kinfolk, and this is not just about us giving to the community; it's what we receive back. A lot of times when I'm sitting in the workshops that we present, I am sitting there as a member of the community, and I too am learning and gathering information and tools that I can personally utilize and share with others. But it's also a great sense of gratitude and fulfillment that I'm in an organization that can help spread the work and make sure that we continue to be united as kinfolk.
Well said. Well said. Thank you, Zna. This has been an incredible conversation. And for everyone listening, on the screen, we are providing you an opportunity to be a part of the work of the Links and to support the work of the Links, whether it's our scholarship programs, our works with the houseless community, young business owners, we do it all. So there's so many ways for people to be involved in our work. Zna Portlock Houston, I am so excited that we are doing this. I'm so excited that you were here. Thank you for your time and your conversation. And as you said, we're off to a great start, and there will be more. Thank you, Zna, so much for being here. And thank you for launching this. This is going to really be a lot of fun.
Thank you, Tanya. Thank you for what you do.